Hello everyone, I'm Dr. Aarathi, HOD Internal Medicine at SLG Hospitals. Now coming to the next disease, like I said, one is mosquito-borne disease, which is very commonly seen in the monsoon diseases. Second being because of the food and water contamination. Commonly we see is typhoid. I'll just tell you a few points about typhoid. Typhoid, again, most of the patients come with the typhoid, the Vidal report, and say that, we had typhoid. So typhoid again is mostly diagnosed by blood and stool cultures. Usually the blood cultures are done in first week of the illness, and then the Vidal test is usually has to be done only after a week of the fever. And just having a positive report like 1:40, you must have seen the typhoid report which says 1:40, 1:20, and they take it as positive and patient gets treated with typhoid. Even if you had a past history of typhoid, say even in your childhood, the Vidal test can keep coming positive. So that does not indicate that you have typhoid fever. That can be typhoid fever is usually diagnosed by culture test. And what happens is, even if you do a Vidal test, say if there is a resource setting, you don't have a hospital close by where they're not able to do cultures, you can do a Vidal test, and that if there are 4 times titers are very high, 4 times of the usual, then we can suspect it could be typhoid. Again, typhoid needs antibiotics, say for about at least 2 weeks. We give sometimes IV antibiotics, and if required, oral antibiotics and IV antibiotics can be given based on the severity of the illnesses. The other common illnesses which are waterborne are mainly hepatitis A, that is presenting as jaundice. And then we see leptospirosis when you come in contact with muck and dirty waters. The contaminated urine of the animals can cause leptospira infection. All these can be diagnosed by doing the appropriate serology test and then treating it appropriately with the antibiotics. Now again, these food and waterborne infections are preventable. Certainly if you are eating healthy food, if you are boiling your water, try to always cover your food, because this is how easily these can spread. Now important word here I want to say is about the vaccination. See, for typhoid and hepatitis A, there are vaccinations available. Of course, dengue, malaria, the vaccinations are in pipeline. Still a lot of research and work is going on. We don't even, those vaccines are not available. But certainly for typhoid, there are oral and injectable vaccines. And for hepatitis A, in children, usually we are giving these vaccines as part of the immunization program. But adults also who have frequent infections can utilize these vaccinations for typhoid and hepatitis A. Now coming to the other one, that is airborne diseases. Airborne diseases are extremely common during this season, especially seasonal flu, influenza. We had a H1N1 outbreak, say somewhere in 2009. Similarly, the influenza viruses also mutate every year and can cause infections. They can present usually with fever, cough, throat pain, and the usual infections with it just feels like common cold, can sometimes become serious and they can become hypoxic. Again, to prevent it is to wear mask when you're not healthy, use the mask at all times, and avoid being outdoors. You have to try and maintain social distancing. These will prevent not just from COVID but also all these other airborne infections. And most important, you can also take influenza vaccination, because these are yearly vaccines which are available. You can prevent these kind of airborne diseases as well. And lastly, no talk will end without mentioning COVID at these times especially. So COVID is also, we can prevent the next wave of COVID, that is by following social distancing, masking, and also sanitization at regular intervals, and vaccinate. People who are around you, please, tell them to get vaccinated. You get yourself and your family vaccinated, complete the dosage of vaccines. This way, we not only prevent the monsoon-related illnesses, we can prevent any other, epidemic and pandemics here on. So take care, enjoy your monsoon, but with all these precautions that I told, you enjoy it in a safe way. Thank you.